So thank you all for being here today. We are honored to have Dr. Richard Nelson with us. During the past 30 years, Dr. Richard Nelson has presented over 1,750 workshops and seminars throughout the United States on suicide prevention, at-risk youth, teacher stress, violence in today's schools, and human relationships, motivation, and communication skills for educators. He has written numerous articles for professional journals, chapters and books, and has made 5 videotapes on adolescent suicide. He's the lead author of The Power to Prevent Suicide, a guide for teens helping teens, and the book has won awards for the top 100 books for adolescents from the New York City Library and the Chicago City Library. Dr. Nelson received his bachelor's degree in business and social science and his master's degree in school counseling from Emporia State University, and received his PhD in counseling psychology from the University of Missouri-Columbia. Dr. Nelson has been a high school teacher, a middle school and high school counselor, a middle school principal. For 4 years, he was a guidance consultant for the Kansas State Department of Education, and he was an associate professor in the Department of Psychology and Research in Education, and associate director of the University Career Center at the University of Kansas until his retirement in 2007. And he is a recipient of numerous awards and honors, including being awarded the only person to receive the rank of honorary colonel in the Kansas National Guard for his 5 years of suicide prevention workshops for members of the Guard. So, very well qualified and
well, thank you, Amy.
Very well loved here in Central.
But you didn't keep your word. You're supposed to make that short. But
short.
yeah, well.
Short. So, now we're even.
Okay.
Now we're even. Okay.
Well, thank you for being here.
Do you prefer being called Dr. Nelson?
No, it's Richard. Yeah. Ollie, nice to have you with us. Ollie has a copy of the book, which is now out of print. I think you can still maybe get it on Amazon. And Ollie is a high school student at Veritas. And you have a role at that school, and what is that?
I am a chaplain of my house, which means I preach.
Alrighty, and he's interested in suicide. Amanda, I guess everyone knows you're the minister in Baldwin, and Karen is the music director here. So I guess we know each other. I have a couple of goals this morning. One is that each of us, including myself, can learn at least one different thing that we didn't know before. And secondly, that we can reach out and touch one person that maybe we forgot about. And also that I can learn from you. Next month there is an anniversary in the Nelson household, an anniversary we don't like to celebrate. On February 7th, 1975, I was finishing my doctor's degree at the University of Missouri. I had about 3 more months left. I was out of town that week in Evansville, Indiana on a consulting opportunity. Came home Friday evening, February 7th, met at the door by my wife, Barbara, and said, Lorena committed suicide last night. Lorena was her sister. So getting a degree in psychology, I really begin to observe what happened to Barbara's family as a result of that suicide. Begin to ask myself all kinds of questions, not getting many answers. In Barbara's family, her great uncle committed suicide, her uncle committed suicide, her sister committed suicide, and one of the points that's probably not going to be in your handout, but people sometimes think that suicide is inherited. 80% of the time, no. But it runs in families because people learn how to solve problems from what happens in the family. I do have a handout. I will try to follow it as closely as I can. And you want to just pass those around?
Thank you.
And I will be looking at them. I have If we have time, I have, and I think we will, 4 areas I want to talk about. The first is trying to find different ways to understand suicidal behavior. And by the way, I think most of you know Becky has joined us. Becky is also in charge of Stevens Ministries in our church. Now, I have a strange question. Does Stevens Ministry have a budget? Yes, Amy said, okay, just asking. I need to borrow some money. No, that's not. Understanding suicidal behavior. As a psychologist, I try to find ways that I can maybe simplify understanding why people behave according to how we observe them. So I use 2 concepts that are not mine. They come from a man by the name of Alfred Adler. And Dr. Adler says that people behave according to how we feel about ourselves at any given time. So if I'm feeling good about myself, feeling good about relationships, feeling good about friends, then my behavior is mostly going to be positive. Very simple. Secondly, all behavior has a purpose. Sometimes we don't know what it is. Now, think of yourselves, and by the way, anytime you have a question, let me know. I will stop once in a while. Did you ever behave in strange ways? Did you, Ollie? Well, I never did, so I no, that's not true. Yeah, we do behave in strange ways. And suicidal people are basically behaving and feeling according to how they feel about themselves. And usually that is very, very negative. Now, number 3 on understanding suicidal behavior is I have a perception of who I am. You have a perception of who you are. But sometimes those perceptions are miles apart. And the best example I can use in suicide is a 15-year-old in southwest Kansas. I'll name him Jeff. Jeff was 15, sophomore in high school. He was academically and musically very, very talented. At age 15, he contacted a strange disease called Rise syndrome. And as a result, he went into a coma, high fever, and they took him to a hospital in Denver, Colorado. They thought really that Jeff would not live, but he did. But as he came out of the coma, it was discovered he had lost over half his hearing. Now, Jeff knew that. Remember, academically and musically talented. His parents knew that. His teachers knew that. His friends knew that. And their perception of Jeff is he can survive. He's tough. But Jeff's perception was not. 3 a.m, he left his farm home, took an all-terrain vehicle and drove 3 miles to a state highway and sat in front of that semi-trailer and committed suicide. He left 3 notes in a computer. His parents woke up and discovered he wasn't there. The notes were to, number 1, Mom and Dad, I really love you. It's not your fault. To his sister, I also loved you. And to one of his teachers, he said, why didn't you hear me? I told you what I was going to do. So that's a very dramatic of how the perceptions get in our way. Yes.
themselves as different.
Yes, that's strange. When you get into anorexia and those kinds of eating disorders, at one point, those are very, very difficult to treat psychologically. But at one point, to kind of prove the perception is they discovered that if they did videotapes of the individual with the disorder and put that in a situation that the person could see that but didn't expect to see it, when they saw the videotape, they saw the real body, which wasn't healthy. So we used to do some weird things, and we still do in psychology, in trying to change people's behaviors. And one was to show the worst in an alcoholic and the worst in an eating disorder and take pictures of that and then tell the person, yeah, now get better, okay. I can also remember, Ollie, when I was a junior in high school, my uncle Carl said to me, Richard, you better really enjoy high school. It's the best time of your life. And I'm sitting there thinking, hey, this is the best time of my life. I'm in big trouble. Okay, so.
Perception.
Yeah, perceptions, yes. And we do that. Sometimes it creates problems for us because our perceptions are wrong. Fourthly, trying to understand human behavior is, why in the world would a person do that? How could they do that to their family? How could they do that to their friends? And one of the reasons, for instance, is a person who is in a truly suicidal state, and usually that only lasts 72 hours or less. So if anything, and we're talking basically about young people, when I started my first suicide workshop was in October of 1979. So I'm not too good at math, but I think that's over 40 years. And I was asked to do that because the Shawnee Mission schools, 5 high schools the year before, in each of the high school had 2 students that completed suicide. So you ask, why would they do that? Short period of time, but a suicidal person, most of the time, our decision-making continuum is on a long line from right to wrong and black to white. And a suicidal person, do I want to live or do I want to die? But as they get into crisis, that continuum shrinks. And there are only 2 things literally in their mind. Do I want to live or do I want to die? And because of that constricted thinking, 85% of the time they don't have the ability to think about family or friends. You know, I think about Barbara's family and how they went through. It was at least 4 years before Barbara's parents could really talk about Lorena. So why could they do that to their family and friends? They simply don't have the ability to think about that. Now, 15% of the time, yes. Sometimes suicidal behavior is done to get even with family and friends. Sometimes suicidal behavior is to get attention. 15-year-old freshman at Skyline High School outside of Pratt, Kansas. She did an attempted suicide, very mild attempt, but after that then went to her coach and said, you know, I think I ought to be starting on the basketball team, and if I don't, guess what I might do? So that's kind of controlling, to say the least.
Teenager being manipulated?
Oh, no way. So 72 hours or less. And the good news is they really want to die. Okay, so are we okay so far? When I did workshops with students, one of the things that I had to emphasize, Ollie, was the idea that that person didn't really want to die. And the problem with young people is, who are thinking about suicide, is they usually go to a friend and say, whatever you do, don't tell anybody, but I'm thinking about suicide. Happy Corners Elementary School outside of Brookville, Kansas. 13-year-old 8th grader on a Friday. She told her father, I'm not feeling well today, I'm going to stay home. Father comes home at noon to check on his daughter and finds that she has committed suicide. When we go to Happy Corners Elementary School, 5 of her friends told us, she told us what she was going to do, but we thought she was kidding. We told us what she was going to do, but we didn't know what to do. So one of the things that I do with young people, Ollie, is I beg them, I plead with them. If you ever have someone come up to you and say, whatever you do, don't tell anybody, I'm thinking about suicide, find an adult that you trust and say 4 words. I need some help. Okay? Now, Ollie, I have given him an idea. Yes?
What about the survivor's guilt then from these
It really is. Yeah, yeah. I used to say, you know, I kind of feel when Amy asked me to do this that it's kind of like coming out of retirement, and I wasn't sure I could still do it. So I've been fussing about this for actually only about a month. It seems like 4 years. But I used to say that the victim of suicide is not the body in the coffin, but it's the survivors. And it lasts, and it lasts. And it really typically doesn't go away. Now, they really don't want to die. 72 hours or less. And one of the reasons that it is important that ordinance exists that you can't get a gun for at least 3 days. 3 days. That wasn't true in 1981. KU female student in psychology class went to her professor after class and said, the professor said, "My, you look nice today." And the student said, "It's just my makeup hiding my depression." So the professor, as many teachers would do, just didn't understand what was going on. Young lady walked downtown Lawrence, purchased a gun, went to the park, and committed suicide. Now, because of that, Lawrence has an ordinance, I think they still have it, that there is a 3-day waiting period. So who's at risk? When I started, it was ages 15 to 24 and 55 and older. Now, the 55 and older, I think some of us qualify for that. The 10 to 24, some of us qualify for that. 55 and older is usually related to some kind of a medical condition. And I guess I can kind of understand one's thinking as an older person. how that could happen is not something that I feel that I could do. It also sometimes follows the death of a married couple. And I can understand that. Young people, there are three kinds of depression, the three categories. One is a depression that can cause a chemical imbalance. The chemical most often is a chemical in the brain called serotonin. And serotonin is kind of like a spark plug in a car, kind of gets you going. And strangely enough, there was a TV show yesterday that had a psychologist on it, and I had never heard this, and said that you can positively affect serotonin if you compliment other people. I didn't know that. Or compliment yourself. So, you all look nice today. I'm not going to get ahead of it. How are we doing so far, Ollie? We doing okay? You and me? Okay.
I saw that show, and I think he also said, try to make that your goal every day to
Yes.
say something.
Yes. Yeah.
I taught for 40 years, teenagers, and
Yeah.
I tried every day for my students to say, especially ones that I
Yeah.
thought were like having a bad day, like you are doing such a good job.
Yeah, and
You all accomplish.
it's important, Karen, to keep in mind that if we positively affect one person, that automatically is, and some of us will know what Amway is. We automatically positively affect 7 more who are in that person's life. So it kind of becomes catching. Absolutely, absolutely.
And a lot of it, I told them I did this, and they just looked at me. Every Friday, I would randomly pick 5 or 6
Yeah.
kids, and I would call their parents and say, your kid's doing such a great job.
Yeah.
And I would call them, the parents, of course, would go like, what did you do wrong?
Yeah, that's right. That's right. Yeah, sometimes people used to ask me, why have we had such an increase in suicide? And I would come up with strange things like, well, partly it's because of air conditioning. Yeah. When I grew up in Lindsborg, Kansas, people used to sit on the front porch till the house cooled down. And sitting on the front porch, they also communicated back and forth. If I got in trouble uptown in Lindsborg, by the time I walked a block home, my mother knew. Okay? So who's at with those age groups? The 3 primary causes of young people's suicide. Number 1, 50% come from a dysfunctional family. Now, there isn't. But we have to keep in mind that means the other 50% has a functional family. Now, dysfunctional. Lawrence, Kansas, high school senior, parents get divorced. Parents decide that he's going to move to Illinois and live with his father. Father says when he gets there, you will leave at 7 in the morning. You won't come home till 7 in the evening. Good luck. So son says, I don't think that's going to work. So he comes back to Lawrence to live with his mother. And the divorce was so terrible that the judge says to mom and dad, you will not see each other unless there is a social worker present. So one morning, the young man leaves Lawrence High School, goes to the farm of his grandfathers, emails 10 of his best friends, says, I'm going to commit suicide. I hope you'll do the same thing. So he commits suicide. The family was so dysfunctional it took mom and dad 10 days before they could agree on a date for a funeral service. So dysfunctional families. About 35% of the young people in Kansas who attempt or commit suicide have a drug problem, substance abuse, and a third leading cause for young people is a breakup in a love relationship. I started to say that when I began to do workshops, the age was 15 to 24. And now it's 10 to 24 because the aggressive, violent, disruptive behavior is moving down in age.
And these poor kids who suffer from all three of those.
Yes.
They come from a dysfunctional family, they're on drugs, and they broke up.
Yes. Yes.
What do you think about how likely that is?
Oh,
To
yeah.
have the trifecta, right? Because of the way that we self-medicate, the way that we, I mean, those two things are very highly likely to end up being concurrent in young people.
Now, then we have to ask ourselves, who in their world is able to see that? Is it a minister? Is it a teacher? Is it a parent? We asked in some research, well, it totaled over 15,000 junior high and high school students this question. If you were thinking about suicide, who would you talk to? Parent, another adult, teacher, counselor, minister, or friend? What do you think they picked? 90% of the time. And again, they go to that friend and say, whatever you do, don't tell anybody. And confidentiality is important for young people. So we need to find ways to break that down. Academically gifted students are while in high school, 20% higher risk. We think because they see an imperfect world and they don't see that anything could change. And then also, gay and lesbian youth while in high school is a 20% higher risk. Now, when that group gets out of high school, that risk factor decreases because the community outside of high school is more accepting, more warm, and more understanding. But while in high school, it isn't. Now, two things I haven't done research on, but to me are obvious that have happened in the last 10 years. One is the whole issue of bullying in schools. I know has added to suicidal behavior. And then the second one that I don't have any research on, and I couldn't find any, is look what's happened to our world in the last 3 years, in the last 5 years, how people communicate. We text message instead of get on the phone. Well, we do that on the phone, but we don't talk to people. We isolate. That support system is totally different. And then we look at the world and we see classified documents, which will drive us crazy if we're presidents. But the whole world is kind of, well, how do you see the world, Ollie?
Just generally messed up.
Okay. Can we change that?
Not most.
Okay. So how are we going to deal with that? That's a tough question, okay? Now, sometimes, and thanks for trying to answer good. I don't have the answer. Sometimes I used to think about if we get a room full of people and this half is suicidal and that half isn't, what's the difference? And at times, I truly believe, I think the half that isn't has some kind of religion or some kind of belief in a power that they can use when it's crunch time. Now, it's nice of me to say that in a church, but more importantly, that's really how I felt. Because as I listen to people, anytime we're in a crisis, you know, if we can get that friend, if we can get that relationship with somebody else. So depression, chemical, about 10% mental illness diagnosed, but 80% of the time that depression is called a situational depression. It's tied to a situation in our life. It can be the breakup in a love relationship, it can be drugs, any negative situation, the dysfunctional family. Complicated. Okay. Yeah.
I've been thinking a lot about, because my middle son has just entered this high-risk age group. He's 11 now, so he's just on the side. And I also know that he was born in the month after Sandy Hook shooting. Has never known a world in which even elementary schools weren't subject to that. And it's very normal for my kids to come home and talk about how the active shooter drill went today at school, how the lockdown went, where their favorite hiding places are. The substitute teacher didn't understand why they had to turn off the lights and was, you know, they were glad it was just a drill because that teacher would have gotten them killed. I mean, these are normal dinner time conversations.
Yeah.
And I think, do we have any research that links that to me it seems like continuous trauma, right? To have to I did not grow up having to move where I was five if someone entered my classroom with that. Are there connections there with increasing or the decreasing of the age range for the
Okay. David Elkind wrote a book in the late 1990s called All Grown Up with No Place to Go. And in that book, he basically talks about we are giving young people behaviors. They're wearing makeup at a younger age. They're dating at a younger age. They're exposed to these things at a younger age. And so they get to age 10 or 11 or 12 and look around. I have all these behaviors, but there's no way for me to do that because I can't. I'm not old enough. So Amanda, I cannot answer your question, but I can and I will, since I know where to find you, see if I can Google something. But obviously that, you know, the 11-year-old, the important thing for me is that you told me is they come home and talk about that. In other words, something in your family you've done correctly. Okay. Yeah. When I say that, I think about one of the couples I worked with. I typically would ask the parent, "What's it like at dinner time?" Because that's where most communication takes place in a family. And mom and dad were both educators, and boy, what's it like at dinner time? Oh, Dr. Nelson, you're going to love this. We decided it's important for our two girls to learn that it's enjoyable to read. So we each bring a book, and we read while we eat dinner. No communication. No communication whatsoever. No place. And so we made some changes. Parents always used to surprise me once in a while. Well, Dr. Nelson, we're not sure we have a problem, but our teenage daughter, if she's 14, when she wants to have sex, she asks us to leave the room. I said, that's no problem. No. Same parents. We understand your office is in Bailey Hall, and we understand there's a fire escape that comes into your office. We don't really want people to see us going in the counseling center. Could we use that? So, no wonder some children are messed up. Warning signs, suicidal threats, direct, and what we call veil. You're going to be sorry when I'm gone. And then a direct desire to die. With the depression, we go into withdrawal. In isolation, we do the worst thing. I would assume everybody in this room has been depressed, okay? And the key for depression with me is because of situations you and I go through, that's going to be a normal part of life. The concern we have on depression is if it lasts 10 days or longer. And thank goodness very seldom that happens. But that's the key that we need to look at. So warning signs, depression is a sign. It used to be that people would give away prized possessions. We don't hear much about that anymore. I can remember a 60-year-old farmer in northwest Kansas who went to the local bar Wednesday night and began to drink beer and said to his friends, you know, I've got a pickup out in the back. I don't really use it much. If you'll take me home, you can have it. Well, he did, and then the man committed suicide. Partly tying up loose ends. Barbara's sister, by the way, Barbara's only other sister, attempted suicide 5 times. So I think I can say it. Because of me, Barbara's the only sane living member of her family, but that's not true. That's not true. I think it's the other way around, I'm saying. But her sister had 3 children, and before, a couple of months before, she began to buy the children clothes, etc. In other words, Lorena knew what she was going to do, but she was going to leave her 3 children in the best possible shape, which didn't happen. Some suicidal young people will put themselves in high-risk situations, especially when it comes to automobiles and driving at high speeds. Behavioral changes in grades goes down. School attendance goes down. Change in friends. They quit having anything to do with people they used to. Strangely enough, changes in eating behavior and sleeping behavior in activities. So those are things that sometimes we can see and sometimes we're not able to see those. Loss in their life, breakup in a love relation, death, divorce, separation. We used to think divorce was most difficult on elementary students, but that's not true. It's 1 year at KU, we had 5 attempted suicides, and all of them had found out during the summer when they went home. Mom and Dad were going to separate. And they have all of this baggage that elementary school children don't yet have. So how are we doing, okay? We have about 10 minutes left.
Can I ask a little bit more about the threats of suicide?
Mm-hmm.
Both the direct and the veiled
Okay.
we're all aware.
Okay. The last session I had, by the way, it's on the back side of your handout, is assessing suicidal lethality, and I think, Amanda, that'll kind of get at that. Also on the back half is there's now a new suicide hotline. I've also listed Bert Nash and their phone number as a resource. And I've also listed me anytime you would have any questions, if I can help direct traffic or find an answer, do not hesitate to call or to email me. When we work with suicidal people, are you thinking about suicide? Okay, maybe they've said that, okay? Most often the answer is, well, I think about it, but I never do that. I think about it, but I can't stand blood. But once in a while, it's, well, yeah, I do. Second question then is, have you thought about how you would do that? Now, if they have an answer, we're going to continue to be concerned a little bit more. But if the answer is, I would use a gun, I would jump off a high place, or I would hang myself. Any process that once the method is started can't be changed, that automatically is a level 10. That's the highest risk. Have you thought about suicide? Yes, I have, Dr. Nelson. How would you do that? Well, I think what I'd do is I'd go to San Diego because it's a lovely city. I think I would find a railroad track. I think I'd buy a 12-pack of beer. I'd check the schedule. I'd start drinking beer, and then I'd just lay down.
That's pretty specific.
Very specific. So we're looking at, number 3, how available is the method? Do they have the gun? Do they have the beer? Do they have the high place? This young lady went to San Diego. But before she began to drink the beer and lay on the railroad track, she called her mother in St. Joseph, Missouri, to give Mom one more chance. And guess what? Mom came through. I don't know what Mom did. So, are you thinking about suicide? Do they have a method? How specific is the plan? And where would you do that? And the more remote the location, the higher the risk. And most young people believe, mostly in their own home, okay? Which tells me that that's a high place for rescue. I think of a young man in Topeka. Came home on a Friday afternoon. He again was very gifted and academically talented. Showed his mother a picture of a swing with one rope. Said, "What do you think, Mom?" Mom said, "Oh, they'll be okay." Still one more rope to help him. 3 days later, he comes home after school and hangs himself. Mother's never going to be able to see that, but he hung himself in a part of the house that Mother's wheelchair couldn't get to. So sometimes the plan is very, very specific and very well orchestrated. I don't expect you to necessarily ask the questions, but I want you to have them here. Are you thinking about suicide? How would you do that? Is the method available? And where would you do that? And then lastly, I want to be sure that a person that I'm talking with isn't on drugs at that particular time, that particular moment. Has there been a recent loss in their life? And what's their support system?
I always had a lot of young folks. Nobody loves me. Nobody understands me. Nobody likes me.
That's a tough one.
When you know that isn't true.
No. But again, the perception. Hey, you people are good learners. Gee, we'll do this next Saturday, but do it without me. No. Other questions? Again,
A little bit about why academically gifted folks are at so much risk. Are there other, I mean, is that highly tied to that self-perception? Is that, or do you really think it's just that they have a greater sense of the hopelessness of the world because of understanding history and
Can I add something? Yeah. I mean, they could be pushed from behind to excel, and they can't excel. I mean, they're excelling.
Yeah.
I think of people, the Suzuki method, or in some cultures, and that.
That's why I asked about
Yeah.
that perception gap that I have known gifted young people who seem to think that that's the only thing people value about them, right? Their ability to achieve stuff. When in fact that wasn't true. If you went and asked their friends, if you went and asked their teachers, if you went and asked their parents, they could list all kinds of other things they cared about that person. But their self-identity had become so wrapped up in that label of excellence and achievement.
Perfection,
Yeah.
and they fall off.
and then you get into the helicopter parents who kind of add to that dilemma. I have suggested to Ollie there is a program in schools. It's called the Yellow Ribbon Program. Have you looked at that yet, Ollie? Okay, we'll do that together, you and I. Yellow Ribbon Program is a very simple program that some schools have used, and in that school, every student is given a yellow ribbon, and they are simply told, if you're in a crunch, if you're really hurt, if you really need to talk to somebody, all you have to do is show that yellow ribbon to an adult in this school, and you will have their immediate attention. You know, kind of gimmicky, but guess what? It works. Yeah, it works.
Silent signals.
Yeah,
Yeah, they're very, I don't want to say deceptive, they're very subtle.
yeah. The other concern I have, and I don't know where are people your age learning about suicide? Do you have any programs in school?
I don't think we do.
Yeah. So if
No one does because we've had teen suicides.
Yeah.
We've had 2 in my time this past over 5 years. We've had 2 teen suicides. So there's a lot of resources being poured into
yeah, okay.
suicide prevention in our community.
Yeah. It's people used to say that if you talk about suicide with people, it's going to increase suicidal behavior. That simply is not true. In fact, there's a great deal of relief that if you can talk about it, then I can talk about it. Yeah.
Even asking them about their plan does not increase it.
No, absolutely not. No, absolutely not. Yeah. Well, my goal has been reached. I've learned some stuff today, and I hope the other goal is that you've learned some stuff today. And I guess happy Saturday, huh?